Now, let's continue with the darrow-yannet diagram, guys. Already we have discussed about the body fluids, the intracellular fluids, extracellular fluids, the differences. Now, let's discuss about the darrow-yannet diagram. See how to understand this darrow-yannet diagram. First of all, if you go back, here already I am showing you the darrow-yannet diagram. The diagram which I am showing you here, this is the darrow-yannet diagram. Look on the x-axis. Let's divide it into x-axis and y-axis. Okay. Now, on the x-axis, look, what is given? Volume is given. Volume is given on the x-axis. And on the y-axis, what is given? Osmolarity is placed. Okay, osmolarity is given. Now, here on the x-axis, I am showing the volume. Intracellular fluids, I already have taught you 2/3 is intracellular fluids and only 1/3 is extracellular fluids. So that's why I am showing a big box and a small box, intracellular fluids and extracellular fluids. And how much is the osmolarity? Let's say osmolarity starting from 0, 10, 20, something like that. What is the normal osmolarity of the body fluids? This topmost, this area, let's say osmolarity is, let's say 300. Okay, actually it's somewhere around 285, let's say it's 300 milliosmoles. Okay, so the representation of the osmolarity and the volume of fluids on one axis, on y-axis I am talking about the osmolarity, and on the x-axis I am talking about the volumes. So this is a diagram which is representing the volumes and osmolarity is called as a darrow-yannet diagram. Now, how this darrow-yannet diagram is going to change in different conditions. For example, see, I am going to explain about the 6 different conditions. 1, 2, 3, 4, 5, 6. 6 conditions I will explain. Guys, first look, here I am going to talk about the isoosmotic changes. Isoosmotic changes means the osmolarity is not going to change. I will discuss about two conditions where the osmolarity will not change. What is the conditions? What are the conditions, sir? Look at the first two examples. First example number 1, let's say the patient is having diarrhea. Okay, the patient is having what? Diarrhea. Now you tell me, when a patient is having diarrhea, is he going to gain the water or lose the water? Definitely lose the water, sir. So which fluids are easy to lose? Extracellular fluids are easy to lose. So that's why when a patient who is suffering with diarrhea, there is loss of fluids. See, from the extracellular fluid, I am showing the arrow outwards. So there is loss of water. And that too, which type of water he is losing? He is losing isoosmotic fluid. See, isoosmotic fluid. The word is important. The isoosmotic fluid is lost from the ECM. Which means, what is the osmolarity of the intracellular fluid? 300. What is the osmolarity of the extracellular fluid? 300. And whatever the fluid that he is losing, the fluid osmolarity is also same, 300. Okay. So that's why in the darrow-yannet diagram, there is no change in osmolarity. Osmolarity is not changing. Still the patient is having the osmolarity of the 300. 300 osmolarity is not changing because the whatever the fluid that is losing, it is not a hypertonic fluid or not a hypotonic fluid. It is an isotonic fluid. So osmolarity is not changing. Okay, na? So what is changing, sir, then here? The extracellular fluids are shrinking. Okay, there is volume contraction. The volume contraction, the extracellular fluids are decreasing. There is no change with the intracellular fluid, only extracellular fluid decreasing. Simple. The person is losing fluids out of the body, so extracellular fluids decrease. That's it. First example completed. Now, let's look at the second example. In the second example, the patient is having infusion of saline. Is what he is taking? He is taking saline infusion, sir. Now you tell me, what kind of saline he is infusing? He is infusing isotonic saline. Isotonic fluids he is getting today. Imagine today I am going to some clinic and I am getting saline infusion. So now when I am getting saline, am I gaining the fluids or am I losing the fluids? Definitely I am gaining the fluids, sir. So there is gain of water. What type of water? Isotonic fluid. So the osmolarity, the fluid osmolarity that I am taking is also same 300. So will there be any change in the osmolarity? No change in osmolarity. Intracellular fluid, extracellular osmolarity is still same. No change. So here also still it is 300. Here also still it is 300. Okay. Now, what is the change that you can appreciate here? The extracellular fluids, see, they are increasing. The extracellular fluids are increasing. In the first condition, extracellular fluids are decreasing. In the second condition, the extracellular fluids are increasing. So from today, you have to say, a patient who is suffering with diarrhea, what kind of darrow-yannet diagram change you will see? The extracellular fluids are decreasing. That's it. In a patient who is having saline infusion, which type of saline? Isotonic saline infusion. The extracellular fluids are going to increase. That's it. So with this successfully what we have completed the isotonic changes. Now let's see hyperosmotic changes. Hyper means what? More. Means the conditions where the osmolarity is going to increase. The osmolarity now it will rise. Let's look at the examples. First example is, let's say, water deprivation. The person is not drinking the water, sir. Let's say the person is getting dehydrated. Okay, maybe because of sweating, or water deprivation means the person is losing the fluids out of the body. Okay, maybe imagine the person is in the desert. Okay, he's in the desert, sir. He's walking along with the camels. He's walking. Now tell me, whenever you are walking in a desert, tell me, are you losing the fluids or not? Yes, you are losing the sweat out of the body. But important point is, yes, of course you are losing the fluid. But what kind of fluid you are losing? Sir, sweat is hypotonic. Look at here, there is loss of fluid. Okay, but what kind of fluid? Hypotonic fluid or hypoosmotic fluid is lost from you. The sweat is a hypotonic. So you are losing the water. So yes, loss of water. But what kind of water? Its osmolarity is less. Let's say its osmolarity is only 100. Okay, it's only 100. Osmolarity is 100. So it's the pure water you are losing. You are losing the pure water, sir. When you are losing the pure water, what will happen to your plasma? Your plasma is getting now concentrated, means you are removing more and more water molecules. As you are removing more and more water molecules, that too, what kind of water you are losing? Hypotonic fluid. So what will happen to your plasma? Your plasma will start to get concentrated with more number of ions. So what will happen to the osmolarity? In the beginning, here osmolarity is 300. Here osmolarity is 300. But now, as you are losing the hypotonic fluid, as you are losing more amount of water, what will happen to the osmolarity? Now the osmolarity from 300, it will raise to, let's say, 320. It is raising to how much? 320. 300, 320. Now tell me, what is osmolarity here? 320 becomes hypertonic. Now what is osmolarity here? Just as usual 300, sir. Now according to the law of osmosis, we have studied, always water will try to shift from low to high osmolarity. Low osmolarity towards the high osmolarity. So the fluid from the intracellular fluid will shift into extracellular fluid, and he is losing the extracellular fluids outside. Okay, in the form of sweat he is losing. So that's why, see, intracellular fluids are decreasing. Intracellular fluid, it is decreasing. And what is happened to the extracellular fluids? Extracellular fluids are also decreasing, sir, because he is losing the extracellular fluids outside. So first fluid will shift from intracellular to extracellular, and from extracellular to outside in the form of sweat going out. So now you tell me, in a patient who is sweating, how the darrow-yannet diagram is going to change? The darrow-yannet diagram, both intracellular fluid decrease as well as extracellular fluid decrease. Tell me, till how much time do you think this shifting will occur? 24/7, 24/7 this will occur? No. Till the time there will be an equilibrium. Till the time there will be equilibrium. So, what is the equilibrium point between 300 and 320? What is the equilibrium point, middle point? It is 310, 310. So, till the time the osmolarity becomes, 310 here, 310. So, fluid shifting will occur. So, once it is 310, 310, stops. The fluid shifting will stop. So, tell me at the end of the day, what is the normal osmolarity? 300. But now in this condition, what happened to the osmolarity? The new osmolarity is 310. So, finally tell me, what happened to the osmolarity? Increased or not? Yes, increased. So, that's why it's an example of hyperosmotic change. So, always remember, in a patient who is sweating, both the intracellular fluid will decrease, extracellular fluid will decrease with the hyperosmolarity change. Just let's go back and recap. In a patient with diarrhea, simple, extracellular fluid will decrease. In a patient with isotonic saline infusion, extracellular fluid will increase. In a patient who is having water deprivation or sweating, okay, or loss of hypotonic fluid, both intracellular decrease, extracellular decrease with hypertonic change. Next, in a patient who is taking high sodium chloride diet. Now, fourth example I am giving you. In a patient with high sodium chloride diet, today you have decided to eat lot of salt. Okay, you are having salt cravings. Today you want to eat lots and lots of salt. You have taken a spoonful of salt and you are eating it. Okay, sodium chloride. So now can I say something like this? What you are adding into your blood? You are adding sodium chloride. You have added today more sodium chloride. So more the number of ions. Now more the number of ions means more osmolarity. What is the normal osmolarity, guys? Normally the osmolarity is 300. Here the osmolarity is 300. But because of the addition of new sodium chloride molecules, what will happen to the osmolarity of the plasma? The osmolarity of the plasma, now it will become 320, let's say. Increased. Okay, increased. Now, according to the law of osmosis, fluids will always shift from low to high osmolarity. Okay, na? Low to high osmolarity. So that is the reason why the intracellular fluids are decreasing. Intracellular fluids are decreasing. And where the fluid is shifting into? The fluid is shifting into extracellular fluids. And what is happening to the extracellular fluids? Extracellular fluids are increasing. So that's why we doctors always say, if you take more salt, what will happen to your extracellular fluids, or what will happen to your blood volume? Tell me guys, what will happen to your blood volume? Blood is nothing but the extracellular fluid. Your blood volume increases. More the blood volume means more BP. More blood means more BP. So the day you take salt, this is why we say avoid salt in patients with the hypertension. If you take more and more salt, the fluids will shift from the intracellular fluid into the extracellular fluid. And more the extracellular fluid means more blood volume means more BP. Okay. But tell me, till how much time do you think the shifting will occur? Till how much time the shifting will occur? Till equilibrium, till balance point, equilibrium. So what is the equilibrium point between 320 and 310? Middle value, sir, that is 310, 310. So till 310 achieves, okay, till the time it becomes 310, 310, equilibrium attains, the shifting is occurring. So finally, normal osmolarity is 300. But what happened to the new osmolarity point? Now it is 310, 310. So osmolarity increased. Hyperosmotic change. So tell me, what are the two examples of hyperosmotic change? One is either high sodium chloride diet or water deprivation. High sodium chloride diet, water deprivation, what are they? They are examples of hyperosmotic changes. So again recap. Diarrhea. In a patient with diarrhea, extracellular fluid will decrease. In a patient with isotonic saline infusion, extracellular fluid will increase. In the same way, in a patient who is having water deprivation or sweating, both intracellular fluids, extracellular fluid, both will decrease with hyperosmotic change. In a patient who is having high sodium chloride diet, in high sodium chloride diet, intracellular fluid will decrease, but the extracellular fluid will increase with a hyperosmotic change. Okay. Now finally, let's discuss about hypoosmotic changes. Hypoosmotic changes means osmolarity is going to go down. Which condition, sir? Look here, in a patient who is having adrenal insufficiency. What does it mean by the word adrenal insufficiency? Adrenal gland insufficient means damaged. Okay. So because of some reason, maybe autoimmune damage, okay, your adrenal gland, this adrenal cortex is getting affected, maybe because of TB infection or a cytomegaloviral infection or autoimmune disease or metastatic disease. Finally, some reason, sir, some reason, what happened? Your adrenal gland is getting damaged, especially adrenal cortex is getting damaged. Okay. So now, do you think the patient can produce aldosterone? No. Aldosterone levels decreases. Okay, aldosterone level, cortisol levels, they will all decrease because adrenal cortex is the one which produces the mineralocorticoid aldosterone. Now, adrenal cortex damage means no aldosterone. Now, whenever the aldosterone is not there, what will happen to the sodium levels in the body? Sodium levels in the body will decrease. Simple logic, no? It is the aldosterone which will try to maintain my sodium levels. Aldosterone is a mineralocorticoid. It maintains the mineral levels in the body, maintains the sodium levels in the body. The day you are not having the aldosterone, your sodium levels will decrease. So, what happened to the sodium in the extracellular fluid? The amount of sodium in the blood is going to go down. So, what will happen to the osmolarity? Less the number of solutes, less will be the osmolarity. Let's say the osmolarity today decreased. So, intracellular fluid, okay, but extracellular fluid, what happened to the osmolarity? Becomes 280, decreased. Okay. Now, according to the law of osmosis, fluids will always go from low osmolarity towards the high osmolarity. So, that's why the fluid is shifting from extracellular fluid to intracellular fluid. So, what is happening, guys? Extracellular fluids are decreasing and intracellular fluids are increasing. Intracellular fluids are increasing. So, till how much time the shifting will occur? Till equilibrium. What is the equilibrium point between 300 and 280? Equilibrium point is 290. So, till the time it becomes 290, 290. Okay, 290, 290. The fluid shifting will occur. Tell me, in the beginning, what is the osmolarity, guys? The osmolarity is 300. But now, what is our new osmolarity? New osmolarity is 290. So, hypoosmotic change. Hypoosmotic change. So, always remember, in a patient who is having adrenal insufficiency, aldosterone levels are going to be less. So, how the darrow-yannet diagram is going to change? The extracellular fluids will decrease, intracellular fluids will increase. Extracellular decreases, intracellular increases with the hypoosmotic change. Done. Now, the last one, guys. Last one. That is SADH. A condition called as SADH. So, what exactly is this SADH, sir? SADH means syndrome of inappropriate antidiuretic hormone synthesis. Or you can remember it like syndrome of increased ADH. Syndrome of increased ADH. There is more antidiuretic hormone. Okay, some cancer, for example, like lung cancer. Okay, the patient is having lung cancer called as a oat cell carcinoma or small cell carcinoma. So, this lung cancer unnecessarily producing what? Excessive amount of antidiuretic hormone. So, there is more antidiuretic hormone in the body. So, now you know antidiuretic hormone, what it will do? It increases water reabsorption from the urine, increases water reabsorption. So now today more and more water is getting reabsorbed, guys. Now where do you think this water will go? This excessive water that is being reabsorbed from the urine, where do you think this water will go? Now water will come and add up here. So that is gain of water. More water is adding. So when you are adding more water, so what will happen to the extracellular fluid? Extracellular fluid will increase. So as you are adding more and more water, as you are gaining more and more water, what will happen to the osmolarity? Osmolarity will decrease. From 300 it will decrease to 280. Here it is how much? Here it is 300. So now water will move from low towards high osmolarity. So the water first is coming to extracellular fluid, and from here, from the extracellular fluid, the fluid is shifting into intracellular fluid. So that's why intracellular fluids are also increasing. Please change the arrow direction like this. Intracellular fluid is also increasing. So both the intracellular as well as extracellular, look here, both the intracellular as well as extracellular fluids are increasing because you are gaining the water. Simple. Now tell me, till how much time this fluid shift will occur? Till the equilibrium point. What is the equilibrium between 300 to 80? 290, 290. So till 290. Till 290. The fluid shifting will occur. So normal osmolarity is 300. What is the new osmolarity? 290, sir. This is the 290. It's decreasing. The osmolarity is decreasing. So that's why it's also an example of hypoosmotic change. So now tell me, what are the examples of hypoosmotic changes? Hypoosmotic changes examples, two diseases. One is adrenal insufficiency and SADH. In both the conditions, the osmolarity will be less. And what are the examples of conditions where there is high osmolarity? Simple. One is high sodium chloride diet, other one is sweating, high sodium chloride diet, osmolarity will be increasing. But what are the conditions where osmolarity will never change? Is going to be remain normal 300. Conditions like diarrhea, the patient suffering with diarrhea, and infusion of normal saline, isotonic saline. So in different conditions, what I'm trying to say, in different conditions, look here, in different conditions, the body fluids will shift from intracellular to extracellular, something like that. How the question is going to show up in your exam? For example, if I am the examiner, this is the question that I will give, x-axis, y-axis, and this is the normal darrow-yannet diagram. Let's say here is the normal darrow-yannet diagram. Now tell me, what is this condition in which the darrow-yannet diagram is going to change like this? So this is how it is changed, which means the intracellular fluid decreased and the extracellular fluid increased. Okay, extracellular fluid increased. So what is this condition? And with the hyperosmotic change, okay, there is hyperosmolarity. What is this? So this is an example of high sodium chloride diet. High sodium chloride diet. Have I taught you? In a patient with high sodium chloride diet, look here. In a patient with high sodium chloride diet, extracellular fluid is increasing, intracellular fluid is decreasing with hyperosmolarity change. So they will show you the diagram and they will ask you what happened in the patient. Is it high sodium chloride diet or SADH or adrenal insufficiency or diarrhea or saline infusion? Okay. So with this, successfully what we have completed the topic of darrow-yannet diagram also, which is very important for your NEET PG and INI CT exams. Hope the video is helpful. Thank you.